The WHO's chief arrived in Congo amid the Ebola outbreak in the region, and he said the spread of the virus, which has claimed over 200 lives reportedly, can be stopped. The WHO chief landed in the capital on Thursday evening and will be traveling to Ituri province, the epidemic's epicenter, on Friday. The UN Health Agency's chief adding that the WHO did not support travel bans to combat the outbreak because they don't help much. The WHO has recorded 10 confirmed and 223 suspected Ebola deaths in Congo since the outbreak was declared on the 15th of May. This is out of more than 1,000 confirmed and suspected cases. In fact, according to its latest figures, up to May 24. Meanwhile, the WHO has also identified Ebola treatments and vaccines to be tested in trials. It has recommended prioritizing 3 experimental treatments for this strain of Ebola. On the other hand, the Director General of Africa Centers for Disease Control and Prevention has said a vaccine against the strain of the Ebola virus will be ready by the end of the year. In terms of aid, the United States has allocated an additional $80 million to help combat the Ebola outbreak in Congo and Uganda. And according to the State Department, with the new funding, total U.S. aid amounting to $112 million since the outbreak started. The United States, Mexico, Canada have also announced aligned public health travel measures for individuals coming from African regions at greatest risk from the Ebola virus. Meanwhile, a Kenyan High Court has ordered the temporary suspension of plans for the United States to set up an Ebola quarantine facility in the country. The High Court judge said that Kenya was also not allowed to admit anyone exposed to or infected by Ebola under the planned agreement with the United States until a case challenging the deal was heard and determined. The statement came after the White House said the U.S. was setting up a facility in Kenya to quarantine U.S. citizens who had been exposed to Ebola, and that it would not bring them home if they developed symptoms, but instead send them to a third country.